part of the campaign strategy to eliminate unidentified HIV patients, a group of civil society organizations is launching the HIV self-test kit in Delta State to fast-track hard-to-reach areas. Briefing health correspondent at a webinar shortly before the launch of the test kit in Delta State, Project Director Catholic Relief Service, FASTA Dr. Emeka Anoja, said they are giving out free 10,000 HIV test kits to every individuals, targeting children and adolescents for contact tracing. Dr. Emeka noted that children are mostly predominant, especially when considering the high rate of infected persons in the state. It is no doubt that the COVID-19 pandemic and its consequence of the movement of persons restriction, as well as the financial and human resource implications, have brought huge burden and barriers in the health sector, notably on access to HIV testing in the country. However, having noted some of these barriers that poses threats to citizens' rights regarding to the UN Declaration of Achieving the 95-95 Universal Targets of eliminating HIV by 2030, experts in the field opine that a conventional approach is needed to obtain the set goals as it has been applied by other developed countries. Thus, bringing to this initiative of distributing self-test kits to beat the desired target. Still speaking, Dr. Emeka stresses that despite the estimated 1.2 million persons who are currently on antiretroviral therapy, over 80,000 are yet to be found, hence the need to close the coverage gap through the test kits while ensuring that citizens are abreast with their HIV status.
Nigeria has the largest burden of gap of HIV treatment coverage amongst children generally under 14 in the entire world. It's believed that, like I mentioned earlier, of the an estimated 140-something thousand children living with HIV in the country, as shown by the NICE survey, only 47 to 50% of them are currently covered on ALT, meaning that at least half of the children living with HIV in the country, aged 0 to 14, are yet to be found. And so there has to be concerted efforts to find them, especially using new approaches and techniques. And we believe that HIV self-testing provides an opportunity. FASTA has procured and distributed about 100,000 HIV self-test kits to support the HIV self-testing efforts across Nigeria. And this includes about 10,000 HIV self-test kits, which will be distributed across Delta states, across the entire state, but focusing specifically on the following local governments: Ika South, Oshimili South, Owele North, and Warri South local government areas. Will be given out free of charge to everyone who obtakes it. It's focusing on children and adolescents, pregnant women, especially those who would ordinarily not have been reached by the conventional means of testing.
Meanwhile, the Executive Secretary, Delta State Agency for the Control of AIDS, Dr. John Osuyali, on reviewing the parts of innovative mechanisms occasioned by the state government, laments that Delta State has one of the 8 burdens on HIV in the country, having about 40% of RIVERINE, therefore making it difficult to implement the planned program, but remain resolute that with the launch of the test kits, there will be zero tolerance to the menace.
We have 7 major tribes in Delta State, with some additional ones that are very minor. Then it's a very difficult state in terms of terrain. We have uplands, only 60% upland and 40% riverine. The riverine terrain happens to be the hard-to-reach areas. Water transportation is extremely costly. In fact, it takes us close to 30 to 40,000 naira to transport ourselves per person, to transport ourselves from upland to inland. Why I'm bringing this to highlight is it has really impacted on most programs that we design. especially when our programs are designed from outside the states. Partners are coming to the state, just coming only to discover that it's not too easy for them to operate effectively in the states. So these factors have been barriers in some of the activities that we've been having. Recall, Delta State was regarded as one of the 8 boarding states in the country. And this was a very big opportunity for us to really see how we are aggressively going to our case findings. However, we still have some limitations at the riverine areas. We are only waiting for the rains to subside a bit. Those are some of the challenges in getting those areas. We have very limited time to work in the riverine areas, maybe 4 months in a year, effectively. Then for those 4 months, you just have to have materials on ground and enter aggressively. So hopefully by January, it will be a different story. But it's remarkable to note that within 10 months, we have been able to enroll over 18, in addition to the 23,000 that were on ground as at December 2019. So as I speak now, over 41,000 persons have been enrolled into treatment. So we are virtually reversing the trend. And I hope another nice will be on ground. By the time they come back, there will be 0 persons on ground for us to bother about.
FASTA is aimed at accelerating the effort of the state government while ensuring sustainability of contract tracking. Vincent Okushi reporting for Quality Television.